our Health Talk series, our guest today is Dr. Umakanth Khatwa. He is sleep specialist at Boston Children's Hospital. Also, he is director of sleep laboratory there. We are going to talk to him today about sleep disorders, especially in children, and sleep apnea. Also, he will be one of our speakers about this subject at our Health Expo on April 3rd at Burlington Marriott Hotel in Burlington. So, Dr. Khatwa, welcome to our studio.
Thank you very much, Upendraji. Glad to have you here.
Excellent, and thanks very much for your time.
Thank you.
So, let us start with what is sleep and what is sleep disorder?
Sleep, there is no one definition for sleep. Sleep is defined as a reduced state of consciousness where the person or a species is temporarily unresponsive and it is reversible, unlike coma, which may not be reversible. And it has a species specific position. So it is very difficult to define sleep in one word, but it has a lot of important role to play. There is not enough data to understand what is the role of sleep, but we know what happens if you don't sleep. And sleep has been attributed to have a lot of functions. We know that we spend 1/3 of our life sleeping. That means if sleep was not that important, the entire evolution must be wrong. So sleep has a very important role. Number one is body restoration. So there are mainly two types of sleep, dream sleep and non-dream sleep, what they call as REM sleep or non-REM sleep. Your body tissue restoration, recovery happens during non-REM sleep. During REM sleep, your brain restoration happens. Because of the synaptic pruning, your brain recovers and memory consolidation happens.
So I have read that something happens in the morning or later on in sleep or something. Which one is the brain one?
So what you're trying to say is, among the two types of sleep, the REM sleep happens during the latter part of the night.
Okay.
That's when we tend to dream. If you wake up from your dream, you can see that it's a little bit early in the morning. And the non-REM sleep happens much earlier part of the night.
So it is the REM sleep where you have the dream?
Yes.
Okay.
The REM sleep is also called dream sleep when we actually dream.
Okay. Okay.
So the other functions of the sleep are memory and consolidation. That means you are sitting here today and I'm talking. I'm saying something about your sleep. You're going to remember this. If you pay enough attention, if you want to form that into a short-term and a long-term memory, that's when happens during your REM sleep. For example, if you have a bad night, if you have a disturbed night, whatever you have learned from different environmental cues or reading or writing may not form into a solid memory, so you may not be able to recall it. So that's one of the important role. And the last is detoxification. That means your entire toxins which accumulates because of your process of working, reading and writing, your metabolic activities in the brain tend to detoxify. And you know that if you don't sleep for a few days, and animals in the lab, if they are sleep deprived, they can actually die. And you can feel that your body even smells if you are sleep deprived for even 1 or 2 days.
Yeah.
So it has a detoxification role in spite of all the other roles I talked about.
That's beautifully explained about sleep. So now you also mentioned species, different species. So can you elaborate a little bit about that, how sleep differs?
So humans cannot stand and sleep. They have to lie down and sleep. And similarly, if you look for aquatic animals like whales or for example dolphins, what they have is hemispheric sleep. So that means half of their brain sleeps and rest of the brain is awake. So they can continue to swim and they can check for the environment and they can make sure that the alternating brain get rest while they're migrating from miles and miles into the ocean. For example, horses can stand and sleep. And sometimes giraffes can also stand and sleep. And some of the animals like dogs and other things, they have to lie down to sleep. So every species has a specific position for it to sleep. And birds tend to sleep sitting on the branches with their heads into their neck and fold itself off and sleep. So it's very interesting phenomena. When you sleep, everybody or every species goes into a particular position.
So now, you said that for the humans, 1/3 of our time we sleep. What about these different species? They have a similar time ratio? Or
Yes, and again, we will not go into the details. And particular, for example, mice, what they are called nocturnal animals, they tend to sleep during the daytime and they are awake during night times. And their sleep cycles are much shorter compared to the human sleep cycle, which is a 24-hour sleep cycle based on the Earth because of the rotation of the Earth, which is about 24 hours in a day. So in that, we sleep about 8 hours, which is 1/3.
Now, what is, in terms of, we have read different things, from different researches, how many hours of sleep we must have minimum? And how much is too much?
I think that's an excellent question, and that's $1 million question. And I think so much has been done on this and so much has been written on how much sleep we need. So let's start from childhood, right? So when the baby is born, most of the time what the baby does is sleep. So baby sleeps between 16 to 18 hours. And the sleep is not in a stretch. It doesn't sleep at a stretch 16 hours. So it may sleep for 4 to 5 hours, take another feed, another sleep, another feed. So there are a lot of cat naps through the day. So by 3 months, your sleep tends to get a little bit consolidated, that most of the sleep happens during nighttime, and there are about 3 to 4 naps during daytime. So you can see the baby by 3 to 4 months doesn't necessarily need to give multiple feeds during night. So the duration of the sleep may be like 15 hours around that time. By 6 to 12 months, and you need about like around 14 hours of sleep, sometimes 15 hours. So the sleep is not that one number fits all.
Sure.
So it's a spectrum. There are children who sleep longer, there are children who sleep on the shorter side. So by first year, most of the children are having about 12 to 14 hours of sleep, and that means 12 in 24 hours. So they may sleep for 10 to 11 hours at night, and about 2 hours of nap, 2 to 3 hours of nap. And as the child grows, by 4 to 5 years of age, they stop napping, and they are sleeping between 10 to 11 hours of sleep. And teenagers need between 8.5 to 9 hours of sleep, and as an adult, people say between 7.5 to 8 hours of sleep. Anybody who sleeps more than 12 hours is considered excessive sleep, and as you have problems associated with less sleep, sleeping more, these are some of the pathological situations where they tend to have also increased health issues.
For adults, for example, adults like us, how many hours is minimum?
There's nothing called minimum. There are people who can absolutely function well with 6 hours of sleep. That's how their body is wired up, and that's fine with them.
Okay.
But there are people who needs about 9 hours of sleep. That's how they function. But on an average, 8 hours of sleep is considered to be average requirement for adults. But I don't want people to understand that I need 8 hours, and that somebody who's sleeping 7 hours and absolutely healthy is not should not be considered themselves abnormal.
Okay.
So
it depends on the body.
individual body's capacity, how much sleep need their body needs.
Okay. So now also anything is you see. I know you are also an expert on the children's sleep. Anything we should pay attention to children or their sleep disorder if we see
Yes,
them?
there are a lot of sleep disorders based on the ages, and then you can divide them based on the timings. That means if a child is going too late to the bed, like typical sleep duration for that child is between 8 to 9, depending on the age. Teenagers maybe a little bit later. If the child is not falling asleep until like midnight or 2 o'clock in the morning, it's abnormal. If it's waking up much later in the night, in the daytime, like 10, 12 o'clock at noon, then that is abnormal.
So what age group we are talking here about? Say?
I'm typically talking about children. So I'm not talking about infants, because the whole infants is I'm talking about school-age children and teenagers. So that's when they are about to go to school, they need good amount of sleep so that they can function and learn in the school. So that's what I'm talking about.
Okay. Now, has there been any study like somebody, this is a crazy question, but I have to ask you, that some study done on somebody who has not slept for 4 or 5 hours, and what has been impact?
4 or 5 hours or
4 or 5 days.
I don't think so. I mean, people claim, some of the yoga gurus and other people have claim that they absolutely do not sleep for 4 days or 5 days. I don't know anybody has done. There are studies where we have extended people like for 48 hours, but I don't know there are actually studies or the studies can be passed through the ethical committee that you can keep them awake for 4 or 5 days, because there are definitely health risks by putting them at such a risk of keeping them awake for 4 or 5 days. But there are a lot of anecdotal like claims in the media that you're not slept, but I don't know, you can literally function by going awake for more than 3
How
days.
long maximum in a nice way you can go without sleep? 2 days, 3 days?
So the thing is, it's more than you go, but how well you can function without like
Sleep,
lack of sleep, because you can keep awake by not sleeping, but you will not be functional after 36 to 48 hours of sleep. Basically, you'll not be
36 to
functional.
48 hours.
Yeah, but then
basically.
you basically become non-functional. So that's the thing. Sleep deprivation is considered a torture mechanism in some of this,
Okay, sure.
people, and that's how you torture people. Is it becomes like pain to be awake more than like 48 hours after that.
Now, let us also talk about, like, say, if I have some sleep issue, sleep problem, or sleep disorder, how do I know that I have the sleep disorder? Sometimes we live in denial, especially when it comes to these type of things. What are the few symptoms we should look for?
So for adults, there are a few things. There may be a problem with insomnia, and there may be a problem with breathing during sleep, or there may be some other sleep-related phenomenon. So for example, insomnia. So a lot of people, they're trying to sleep, they're unable to fall asleep, they become anxious around bedtime, they start looking at their clock frequently, and they're absolutely unable to fall asleep up until 2, 3 o'clock, and they fall asleep eventually, and they have to wake up at 6 or 7 o'clock. So when they wake up, they have a hard time waking up, they cannot focus, they feel extremely tired and sleepy, and they're falling asleep in their work, and actually they may have an accident while driving because they're so tired. So somebody who is unable to fall asleep should be worried about. And not that these symptoms should be lasting for at least 3 months and above. So if somebody has 1 night or 2 nights or a few days because of some situation in their life that they are not able to fall asleep, they should not consider themselves having a disorder unless it becomes persistent for about 2 to 3 months. Then they need to see an expert or a primary care for their for health issues. And the second thing is, if somebody is waking up frequently, they're falling asleep, waking up, falling asleep, waking up, they should consider, and this is persisting for 3 months, and because of that sleep problem, they are unable to function during daytime. So having a sleep problem, having a sleep disorder. So the sleep problem is a symptom, but it's a sleep disorder means if that symptoms become a problem so that you cannot function during daytime, that's when you need to take seriously. So there are people who go to bed late, but they wake up early, but they're absolutely fine. So that is not a disorder. So when you mean disorder, that means they should have effect of the sleep deprivation on their function. So that's one thing. And the next thing is with snoring. Somebody is snoring during sleep pretty loudly to the point that the bed partner cannot sleep, or he pauses in his respiration, which is called apnea, or then he snorts, chokes, and wakes himself up. He's having this persistent mouth breathing and dry mouth, and he's frequently tossing and turning in bed. So that may be a symptom of sleep apnea. So those people, if they have symptoms of sleep apnea.
So before we go, can you tell a little bit about sleep apnea, what it is and what?
So sleep apnea is a situation, the full name is obstructive sleep apnea, or also called as OSA for the short form. So basically when you fall asleep, we lose our tone. When you're sleeping on your back, your tongues fall back, so which is completely occludes your airway. So that means you're falling asleep, your tongues fall back, and you're unable to take a breath inside. And then you're struggling to breathe, but the airway is closed. So what happens is because of that, the air doesn't go into the lung, and you don't get oxygen, and ultimately your oxygen, which should be at 97 to 100% saturation, slowly starts going down, and then you drop your oxygenation into 80s or 70, depending how long is the apnea. So because of the low oxygen, your brain senses that this person is not breathing and wakes him up. That's when you can hear that snort. He can wake up and then take a gasp of air, and then he takes a couple of breaths. That means his brain from a deep sleep has suddenly become awake, and then as soon as he starts breathing, it goes back to sleep again. But he develops apnea again. So he keeps on waking up, falling asleep, waking up, falling asleep. So you have two effects of apnea. One, you are unable to take breath inside. Number two, because of that, you're not getting enough oxygen, your oxygenation goes down. And because of low oxygen, your brain wakes up to make sure that the airway opens up and he can take a breath. So you have drop in oxygen, normal oxygen, drop in oxygen. So there is a roller coaster ride of oxygenation in your body, which is not good for your health. And your sleep becomes very fragmented. So your brain is trying to wake frequently to keep you alive, basically. So you have effect of sleep fragmentation, and you have effect of drop in oxygen. So people, even in spite of sleeping 8 hours, they say I go to bed and sleep 8 hours, If they have sleep apnea, they feel terrible in the morning. They feel tired, they feel exhausted, they feel as if they are not slept.
So what is some medication there or some surgery, or what is the...
So we can also see sleep apnea in children. So the common cause of sleep apnea in children is adenoids and tonsils, obesity, or they have a relatively large tongue, or they have an abnormal dentition. That means they have a very narrow arch and they have a small jaw. So most common treatment for children is one, you remove adenoids and tonsils. If you are overweight, you try to reduce weight. And if there is any dental issues, you have to see an orthodontist. But if the surgery is not an option, then there are different treatment, which including a CPAP. They have to wear a mask during sleep. In adults, surgery is usually not an option. Invariably, they end up on CPAP, and that is the treatment of choice. And people who are obese, much more challenging. People who are extremely obese sometimes may undergo bariatric surgeries, and people who have other dental issues, they may use some dental devices. But CPAP is the main treatment for adults. Adenoids and tonsils is the main treatment for children.
Now, is there, I have to ask this question to you, is this issue of sleep and sleep disorders and sleep apnea, is it different in people of different ethnic origins, so it is common among all or very similar?
No, the whole pathology, physiology is same, but in some certain ethnic group it is much more common. It's much more common in African Americans. It's also very common in Asian.
Like us, India.
Yes,
Sure.
it's very common. But again, apart from the ethnicity, apart from these two, doesn't mean that you don't see sleep apnea in Caucasians or some other population.
Anything male, female versus female?
Yes, that's an excellent question. In children, there is absolutely no difference between a male and female. But once after puberty, is much more common in men. So females somehow they have a protective effect. They can maintain their airway. It doesn't mean that you don't see sleep apnea in women, but relatively more common in men compared to women. So
what percentage, like sleep apnea you might see in women, and what percentage you see in men? Just to give an idea.
So for example, as I told you, about 8 to 12% of the children snore. About 2 to 3% of the children actually have sleep apnea. In adults, it depends on the age. The older you are, you tend to lose your upper airway tone a little quicker, and then you tend to have a high degree of sleep apnea. So there are various studies in various ethnicity, in various risk factor group, but if you consider the general population, about 20, 30, maybe sometimes 40% of the people have said that they have snoring, but around 20 to 25% of the adults snore. About 10 to 12% of the adults have actually sleep apnea. And it depends on how you define and how you diagnose it. Compared to that, it's 2 to 3 times more common in men compared to women at that age.
Now, let us also talk about alcohol, for example. How we hear also a lot of stories. Oh, I just had a glass of white wine or red wine and I fall asleep. And some people, don't sleep, after alcohol. So, does alcohol is there any study which links alcohol with sleep?
Alcohol, some people is very sensitive, so that they take alcohol, they can sleep nicely. But most of the time, alcohol, what it does is basically it makes you fall asleep, but also at the same time it also helps, it increases the loss of tone of the upper airway. So your propensity for the tongue to fall back and collapse. So you can see that people who have drinks, they tend to fall asleep and they tend to start snoring. So when you drink more, you tend to snore more. So that way, what happens is you are unable to wake up frequently, and then that apnea tends to be prolonged in people with alcohol. So alcohol has an effect on the sleep. It can make you sleepy. At the same time, it also reduces the tone of the upper airway, so your airway tends to be collapsing more. So people who drink frequent alcohol are at higher risk of having a severe degree of sleep apnea.
Now, we know that one topic keeps coming up, and that is snoring, and which we see all the time. People complain everywhere. You go to visit a friend, or in your family somebody is snoring, and it is annoying. So why this? How dangerous? First thing, is it really dangerous, serious, or it is just it happens? Yeah.
So the thing is, if you consider snoring for one night, if you think, is it life-threatening? Like today, you're snoring. Will something happen now? Probably not. The snoring is considered a sleep disordered breathing. So this is it causes a low-grade inflammation for the body. And people initially may start with snoring, and then it becomes a little bit more airway collapsing, and ultimate to the point of airway occlusion that you develop an apnea. and this sleep apnea persists for several years, it has a deleterious effect on your health. So it can, one, affect the quality of the life. That means people who have sleep apnea, they feel always tired. They say that I'm sleeping 8-9 hours, I just don't feel good, I don't feel great. So they have complaints at work. Their memory may be affected. That means I was doing very well at work, but now I just keep forgetting things, I'm not able to pay attention, I'm not able to be attentive, I tend to fall asleep in the meetings. So those are some of the complaints. And then as we grow older, they can develop hypertension, they can also develop insulin resistance, they are high risk for diabetes, and people who have diabetes, they have issues with sugar control. So again, they have issues with their lipid metabolism, they can have abnormal lipid profile. So it affects every aspect of health, your well-being, and also affects the aspect of your chronic disease control. So if you have sleep apnea and hypertension, if you have an untreated sleep apnea in a patient who is hypertensive, he tends to be much more hypertensive. So for that reason, if you control sleep apnea, you treat sleep apnea, it also helps to control your hypertension in addition to the medications.
So there are some people, some of our friends, and in our own family, and so they complain that I just cannot sleep. I have to take a medication, sleep pill or something like that to even fall asleep. If you can talk a little bit about that pill and the sleep, how dangerous it is, or it is okay to take, or how much is okay to take.
So I think that's an important question. It's very difficult to answer in one go, but I will try to give my best response to it. It depends on, the most important for somebody to call an insomnia is you should definitely see a sleep physician before taking sleep medications.
Sure, okay.
Because you go to a primary care and you complain that I have trouble falling asleep, they will give you a prescription for Ambien or some other pill, you start taking it, and most of the time if you take a low dose, if you have some real sleep issues with difficulty falling asleep, that may be fine. But if you have other issues underlying which we are not identified and diagnosed, some of the psychiatric disorders, some of the medication side effect, or some of the sleep misperception, that means the patient is actually sleeping but he perceives that he's not sleeping. So if you don't go into the details about the history and they just come and complain that they are not falling asleep, they take the medications, and you may be over medicating the population. So, and also these medications have a tolerance effect. That means you start taking it, it works for a few days, and after that you need a higher dose and you need a higher dose. Then you try to stop it, then you may become dependent on that. So there may be a withdrawal effect. So I think anybody before taking any medication for sleep disorders, they should consider what kind of sleep disorder they have. Is there something, lifestyle modifications or meditations or relaxation techniques can help them? And in spite of that, if it doesn't help, obviously there are medications, excellent medications with good safety profile, they should be considered. And if they're considering medications, they should be important that will that medication have effect on their health? For example, if you have untreated sleep apnea and you're taking a lot of sedatives, it can actually make your sleep apnea worse. So you have to make sure that you don't have anything else which will adversely affect at the cost of sleep.
So if I ask you 5 things which we must do, not talking about medication, but just in lifestyle, what are the 5 things we do to have a good sleep, or which can help us sleep better?
So again, I will try to 4 or 5, whatever it is, but
Okay.
I think these are the most important things from a child or from an adult perspective, is to try to keep your sleep timing pretty consistent. When I mean consistent, that doesn't mean that you have to go to the sleep by that minute. But for example, you have to keep your time zone within that hour. If you're sleeping at 10 o'clock, between 10 to 11 o'clock, and you keep your wake up time a little bit same time. So if you're a 6 o'clock person, keep it 6 o'clock. Doesn't mean that somebody who wakes up at 5 o'clock, force themselves to wake up 5 o'clock is good for health. You need to keep, your body. You know that I need 7 hours of sleep, or you feel that I'm good at 8 hours of sleep. Try to maintain that duration of sleep. For example, if you have an activity, you went for a movie or you went for a dinner outside and you came late, you went to bed at 1 o'clock or 2 o'clock, don't try to sleep in till 11 o'clock or 12 o'clock, because what it does is it upsets the cycle or the clock in your brain. So it's important that you still try to wake up at the same time. It may be okay for you to be a little bit sleep deprived on one day so that you can go back to the bed on the same time the next day. If you tend to wake up late, for example, you went to bed at 2 o'clock and then you wake up at 10 or 11 o'clock, then you may set yourself into a cycle of going to bed late and waking up late, and then then even though you want to try to go to bed early, you may not fall asleep. So keeping your bedtime consistent and the sleep duration is consistent important. Avoid any mind stimulating activities. Like there are people who take coffee or caffeine, so avoid which there is a stimulant. So if people are sensitive to caffeine, I would definitely avoid that, like teas and all those things. And if you want to take it, some people take decaf, and if their body is able to handle it, that's okay. But if people are very sensitive to caffeine, they should avoid any stimulating activity.
And how many hours before sleep time you can?
So any caffeine has a long half-life. So I mean, if I tell my patients who actually come to see me because they have sleep issues, I tell them to avoid after like 2 or 3 o'clock no caffeinated beverages, because it can just linger around. Said that, there are people who take coffee at 5 o'clock or 6 o'clock and they can function. I'm not telling them not to take it, but typically you try to avoid stimulants like
those who have issues with sleep.
They should definitely avoid that.
Okay. So you were talking about the third.
The third important thing for sleep would be to keep the light and dark cues for your brain. That means reduce the amount of light when you're in the evening. So when you come back from work and it is dusk, after your dinner, you just calm the light. So that means you don't have to be in pitch darkness, but try to dim the lights and take away the excess brightness so that it doesn't confuse the brain that it is like a daytime. So more the bright light exposure to your brain around the bedtime, you will have hard time falling asleep around nighttime because your brain, your body needs to wind down. So that's very important. And also, when you wake up in the morning, you need to get a lot of bright light exposure so that it helps to waken up your brain, so-called. So that it says, okay, now it's morning time. So that locks in your circadian timings so that the wake and the sleep times are pretty consistent. So having those light and dark cues is important. One of the important thing I think about is we have a lot of electronic media. There is a lot of FaceTime with that. We have iPad, we have cell phones. So even the amount of light emitted by these devices, particularly the blue wavelength light and green wavelength light, can, if you're spending too much time with those devices around bedtime, can suppress your melatonin secretion, and that can affect your sleep onset. So sometimes that may be the only reason you have sleep issues. You don't even need sleep medications. So understanding your lifestyle around bedtime is very important.
Like how much time I need to see my iPad before I go
So
to bed?
typically people, I mean, we've been telling patients between 1 to 2 hours, so people who are sensitive to that one. So and also there are settings that you can reduce the brightness exposure. And if you're trying to read to help you to fall asleep, I tell them to avoid using iPad or those kind of reading because it still emits the light. So typical good old book reading is important.
Sure, yeah, absolutely. What about food and exercise?
So typically I tell them to avoid exercises because it stimulates your body. So around bedtime, if you want to do exercise in the evening, it's fine. If you want to go for a walk, it's okay. But any vigorous strenuous exercise, for example, if your bedtime is around 10 o'clock, doing that at 8, 9 o'clock may just stimulate you enough so that you may have a hard time falling asleep at that time.
Okay. So I was thinking totally the opposite. I had to do more exercise, you get tired and you fall asleep.
No, we typically don't tell them not to avoid strenuous
good to
exercise.
know,
Light
yeah,
exercise is
sure.
always good.
And what about food? Are there any special type of
There's
food?
nothing particularly
or
food.
timing of food or eating?
I think the most important is being consistent, and is one giving a consistent cues to the brain that this is my dinner time, this is my sleep time, and that helps with the digestion, that helps to lock in your sleep timings. If you have a very haphazard and random food timings, and that will also help your brain get confused. It doesn't know because your food timing is tuned into your circadian timing. So if you get the right cues to the brain that I'm eating between like 7 to 9, so or 7 to 8 o'clock, and then you keep, I'm not telling that every day you have to eat that way, but as many times as possible, keep it consistent. It helps to keep your body rhythm in check.
Excuse me.
So that is about food. And again, I mean, for the kids, I typically tell them to avoid excess of sugar drinks and avoid excess of things which make them hyper, so that instead of falling asleep, they tend to be much more hyper. So there are kids who are very sensitive for the sugary drinks, so we tell them to avoid food.
Now, and same food, exercise, same routine,
Yes.
kids spend more time actually on those
Yes.
blue lights and all this stuff. So same thing is
Yes,
applicable to
the
them.
same thing is applicable, especially for the teenagers, which is very important that most of the kids are doing homework on their computers, and make sure that they shut down their electronic devices at least an hour to 1.5 hours before their intended bedtime.
Now, when we were growing up, we saw our grandfathers and grandparents, go to bed late and wake up early in the morning. Is there any different sleep pattern in elders?
That's an excellent question. So what happens is, as we age, our sleep requirement goes down. For example, like for me and you, we may need about 7.5 to 8 hours of sleep. Like an 80-year-old person may need only 6 hours to 5 hours of sleep. So you may hear some complaints that my granny stays with us, she goes to bed at 8 o'clock, she wakes up at 2 o'clock and she starts cleaning the house, she disturbs everybody. Basically, she goes to bed at 8 o'clock, wakes up at 2 o'clock, she slept 6 hours, she's done with her sleep. She's not insomniac, she's normal. See, just her sleep timings are a little bit off. So in India, the grandparents, typically because of the joint family, they used to hang out with the family members and used to go to bed late. For example, like midnight, wake up at 5 o'clock or 6 o'clock, and that's their sleep requirement. So because they have aged, you tend to have a low.
So what is the age? How do you define the age for that age group?
Around 80s, are the ones like when you cross 80s and mid 80s into 90s, then your sleep requirement really goes between like 6 hours or maybe sometimes even 5 hours. Some people sleep 5 hours.
So now, one thing I'm discovering is, as I talk to so many physicians about this series, that mind is just amazing. That what you told me about mind is that how it is able to sense the light and how it's able to figure it out and functionality. This also leads me to the next question is, there's a lot of studies coming up lately in research about mindfulness and yoga and meditation. Has there been any linkage between them and these research and the sleep?
I think there's a lot of research coming along with yoga and sleep, and actually anything which helps to relax your body definitely helps to calm the nerves and definitely helps with the sleep. And I think people who practice yoga tend to keep a routine rhythm. People who keep routine rhythm tend to have a routine sleep rhythms. People who continue to have routine sleep rhythms have less of insomnia and tend to have a consistent sleep times. So the more you keep your body in sync, I'm not telling you that going to bed at 10 o'clock is good versus going to bed at 12 o'clock is good. But if whatever you do consistently and keep the rhythm and keeping the things which I mentioned to you consistent as much as possible, as many times as possible, your body has a rhythm. Once you break the rhythm or the rhythm becomes irregular, that's when the health problem comes, especially with sleep disorders.
So now, to break this rhythm, how often, of course, we went to a party or we are traveling, once a month. Is that okay to
Oh,
break
absolutely.
that?
I mean, life is fun. You should enjoy life, and at the same time, you have to do things. What I'm trying to tell is, there are times where you go to bed late, or there are situations where you cannot go to bed at the same time that you went to bed late. But try to come back to your closer rhythm as soon as possible.
Okay.
Don't take away the situation which led to the sleep disturbance or rhythm disturbance and continue to perpetuate. If you are irregular, the problem for the body is that fluctuating rhythm. Like one day going to bed early, one day very late, one day waking up early, one day going to bed waking up very late. That's where the body is unable to generate the rhythm. So the digestion, the recovery, the restoration, the detoxification, the process is not completed. So you wake up your body, but before it's completed its sleep cycle, that's when it gets disrupted, and then you have health issues because of that.
So, excuse me. So if I have to take 2 or 3 takeaways from our conversation today, sorry. So if I have to take 2 or 3 takeaways from our conversation today, I think that, correct me if I'm wrong, number 1 will be that you have to be very consistent and you have to follow a routine.
As much as possible.
As much as possible. Number 2 is that sleep is extremely important for regeneration of your health, body, and also your mind. And what will be the third one?
Third one is don't take sleep lightly. And also, if you're having issues with the things we talked about, you may be having a sleep disorder. And there are sleep specialists and there are primary people who can identify and treat. And if you're concerned about your loved ones or yourself, that somehow my sleep may be playing a role into your health, I think there is nothing wrong in going and checking out with a specialist to make sure that something which we can treat it. So these are very easily identifiable, easily treatable. Sleeping pill is not a solution, especially sleeping pill over the counters. These are very short-term fixes. I think if it is 1 or 2 days, it may be okay, but if it becomes a pattern or a habit that you're dependent on those medications for your so-called sleep, then you definitely need to see a sleep person or your primary care to discuss about this.
And my last question to you before I let you go is a link between sleep disorder and depression and stress.
Yes. So it can affect either way. So people who are depressed tend to not sleep because you're depressed, you're thinking about, so you lie in the bed, you get depressed, you start thinking about things, and that may affect your sleep onset. And on the other hand, when you become depressed, once you fall asleep, you tend to sleep longer. So you don't have anything else to do, you're depressed, you just lie in the bed and hang out and just sleep longer. So then you have this pattern that you go into a little bit of an irregular sleep rhythm. And sleep deprivation can worsen your depression. And on the other hand, there are people who tend to be more anxious, it can worsen your anxiety. And especially in teenagers, sleep deprived teenagers tend to be much more aggressive, tend to be much more combative, tend to be much more defiant. So it's very important that if a child is having issues, especially in the school, with the learning, with the memory, especially with attention and focus, and especially sometimes they label them as having ADHD or hyperactivity. I think underlying sleep disorder, which is subtle, you may not be aware that your child is having sleep disorder like sleep apnea because you're sleeping in different rooms, needs to be evaluated. And these days we see a lot of children who come to the clinic who've been labeled as ADHD. In fact, they turn out to have sleep apnea, and treating sleep apnea has treated their ADHD-like symptoms. And treating sleep apnea has helped to improve their grades. So doesn't mean that every child who doesn't do well in the school has sleep apnea, but that may be one of the reasons.
So now another question I have for you is how much role is genetics or DNA plays in sleep disorders?
So there may be some genetic factors related, like people who tend to be obese also tend to have offsprings who are obese. So obese adults tend to have higher degree of sleep apnea. Similarly, obese children tend to have a higher degree of sleep apnea. And again, your upper airway tone, your strength of the muscles, if you have a low tone, so that when you fall asleep, your tongues fall back. So there may be possibility that your children may have a similar phenotype, that they may also have a higher degree that the tongue may fall back more frequently than other kids. So there is some factors which are heritable, but doesn't necessarily mean that every patient who has a sleep apnea should have a child who has sleep apnea, or there may be a couple of members in the family who don't have sleep apnea and the other members have sleep apnea. There is also a lot of heterogeneity in that one, that there is not a one single gene which has been identified which causes sleep apnea, but there are some factors which may increase the risk of sleep apnea in the offspring.
Now another question I have to ask you is, again, I think we might cut it out or include it in the video later on, but I'm just going to ask you, is, the sleep has always fascinated me. I'm big, I'm a good sleeper, and I generally, there was a time I will go to bed around 8:30, I'll be in the bed and I'll up at 4 o'clock. Now it has changed slightly. Now I go to bed around 10:30 and because of work, and then get up at 6 o'clock. So I do follow exactly, the same, the thing you're describing with sleep. I dream a lot too. And, and that's why I asked you the question about dream. And this has also led me myself personally to read a lot about the dreaming, and I've read a lot of books of Carl Jung, and so it has fascinated the whole dream concept and all this stuff. And also it has led me to also some mythological stories, because sleep is such an important part, and you must have heard this character, which always fascinates me, that I don't know if it is possible or not. In Mahabharata, one character is Arjun. Who is the biggest, the arrow and bow player. And so he was known that one of his biggest strength was his control on sleep. That he could sleep as long as he wanted, and he could be up as long as he wanted. And the skill he used in his fighting, in learning, whatever things he wanted to do. So that's the one character which always comes to mind when I think about sleep. And then you have in Ramayana, you have the brother of Rama, who all he does for 6 months he sleeps, and 6 months he's up. So even if you look from the historical point of view or mythological point of view, the sleep issue has been there always. Have you experienced anything interesting or abnormal in the people you treat about sleep? Oh, this was something very unusual. I never thought about that.
Yeah, I have experienced people, especially they don't come to me because they don't have problem, but I've experienced when I talk about their family members on the people who have sleep disorders, when I start taking family history, then they start saying, hey, my brother, he can sleep whenever he wants, he can do whatever time he wants, and then he can be totally functional. He's a top A student, he doesn't have any issues, but I'm not telling that they can go for days without sleeping and sleep as 2 or 3 days, but I've seen within the realm of normal range. So they can sleep like 6 hours and be totally functional, or they can sleep sometimes 12 hours, they can be functional. So there is a range they can function, but I've not heard a character in my clinic who can go without sleep for like 3-4 days and totally function. They may not sleep, but they're not functional. And at the same time, I have not seen anybody who can just sleep for like 3 days or 4 days. The interesting thing about is Umakanth, which you were talking about, Raman's brother. So if you see, there is a condition called Klein-Levin syndrome. So this is a cyclical hypersomnia. It can start in teenagers and goes into adulthood sometimes. What we call as these patients, they go into cyclical episodes. It can last for about 6 weeks or sometimes about 3 months. So during that period, they only sleep. They sleep between 16 to 18 hours. They only wake up to eat and they sleep. So they go to a period of hypersomnia. And during the rest of the time, they can have a normal life. They can sleep normal 8 hours. And during that 6 months, they also have a hyperphagia, which means excessive eating. Okay, emotional abilities. So if you describe the character in Kumbhakarna, they mention that this character sleeps for 6 months and then he's awake for 6 months. But if the nearest closest thing which the medical literature can put a hand on would be a Klein-Levin syndrome, but these are not obese. So Kumbhakarna was also obese. He used to snore a lot. So I'm sure he had sleep apnea, but he also had hypersomnia, which is excessive sleepiness, which was very cyclical. Whether he had 6 months cyclical or is it a mythological, exaggeration of it? So I don't know. But yes, there is a condition which can mimic to it. Plus, I'm sure he had sleep apnea because it describes that he used to snore heavily. And every character you see in TV or movie or magazine about Kumbhakarna, he's lying, he's obese, and he's sleeping and he's snoring.
So has the sleeping pattern, like we know that we human beings have added 40-50 years to our age, in the last 100 years or so, we become more healthy and all. Has there been any change in the sleeping patterns of human beings or human race?
That's an interesting question, because there was a research which came from the tribes in South America. They went there and they gave them this watch where they wear, and these tribes has not even seen civilization. They just go to bed at sunset and they wake up and they are awake during sunlight. So there is no modern life being affected them. So they gave them watch, and based on the watch we can say how long they are awake and how long they are asleep, which is an approximation. Actually, those tribes have a little bit of a lower sleep requirement than us. So that means they go to bed and they sleep by 6 to 7 hours, they're up and awake. So over a period of evolution, I think because of the modernization and the quality of the sleep, we recommend, there is no clear data to say that if you sleep more, you're healthy, or if you sleep less, you're unhealthy, but there is a spectrum. So we say that 8 hours of sleep is a normal requirement. So over a period of time, I think we tend to sleep a little bit longer, but we require sleep a little bit longer. But what has happened in reality is we are sleeping less because of the technological involvement. Now we are connected to the iPhone, we are married to the work, and we spend more time with our technological devices than we actually spend with a human being or your family or kids or wife. You're constantly checking your messages, emails, and even though you're trying to go to bed, something dings and then you want to wake up and check the messages. So I think we have to figure out that we need to shut off the phones about 45 minutes, an hour before, so that when you sleep, you actually sleep.
Well, okay. Umakanth, thank you very much. It was really a pleasure talking to you.
Nice meeting you.
Really excellent. Thank you.